My name is Melissa and I am a nursing student at Seneca College, and today I'm going to demonstrate how I'm going to prepare a piggy bag infusion using a medication called pantoprazole. Before I begin, I have already taken the pleasure of putting my medication, my primary bag, hanging my primary bag. I have my secondary bag available. I have prepared a label with all information, the patient's name, the date of birth information on the label where I place on the prepared medication. I also have a 3 ml syringe with an 18 gauge needle, my medication, which is pantoprazole. I have also my alcohol swabs, my doctor's order, and my MAR ready. The first thing I'm going to do is I'm going to do hand hygiene. I am then going to check my MAR with my doctor's order. I'm going to check the patient's name, which is Mr. PNL. Mr. PNL is his date of birth, which is 1144. The medical record number is correct. His allergies, which he have no known allergies. The doctor, the name of the medication, which is pantoprazole, 40 mg, intravenous every 6 hours, and the time the medication would start. Next, I'm going to check the medication as well with the MA and the doctor's order. So the medication is pantoprazole. Then I'm going to check it's intravenous every 6 hours. The name of the patient, Mr. PNL, and his date of birth is there, and it's 40 ml. Then I am going to check the secondary bag. I want to check that there is no discoloration. I will also check that the expiry date on the bag is valid, that it could be used. Everything is good. I am going to recheck the information on the MAR and the doctor's order with the medications that I have. So I'm going to check again. Mr. PNL, it's pantoprazole, 40 mg IV every 6 hours. Okay, and the expiry date on the medication, it is good to administer. The second thing I'm going to do, but before I do that, I have to calculate the medication. So it would be volume times the drop factor over time. So that it would be 17 drops, 17 GTT per minute for the medication. Then I'm going to sanitize my hand, and I'm going to begin the procedure. I'm going to break the top of the medication. I'm going to use an alcohol swab to clean the top of the bottle. As I said, we're using a 3 ml syringe and an 18 gauge needle. So I'm going to insert these two. Then we have to withdraw 3 ml of the pantoprazole to put in the secondary bag. So before that is done, I am going to remove the cap of the needle, and I'm going to put at least 3 ml of air in the syringe. 3 ml. I am going to insert it in the medication bottle. And I am going to withdraw 3 ml of medication. I will ensure that I have no bubbles, 3 ml. Then I am going to insert it. Before that is done, I'm going to cover it for a minute. And I'm going to use another alcohol swab. And I'm going to clean the site where I'm going to put in the medication. I'm going to do it here so I won't have any leakage or anything. I'm going to insert my medication. I'm going to discard my needle in my Sharps container, and I'm going to gently mix my medication together. After that is done, I am going to put my label that I have already prepared. On my medication, on my bag, sorry. Then I'm going to check for the third time. I'm going to check the what I have prepared with my MAR and my doctor's order. The patient's name, Mr. PNL. The medication is pantoprazole 40 milligrams. It's via IV every 6 hours. His date of birth. And all other information would be on there. Put my medication down. Then I'm going to start to prepare for my secondary line. I'm going to do hand hygiene. And I'm going to go to my patient. So I'm going to go to my patient to find out, to introduce myself and to make sure that I'm seeing the right patient. Hi, my name is Melissa. I'm going to be your nurse for today. Can you confirm your name and date of birth, please? Okay. I will also check the information that the patient has given me with my MAR and my doctor's order. Make sure I'm seeing the right patient. Mr. PNL, date of birth. Okay, Mr. PNL, do you have any allergies? No, he doesn't have any allergies. I'm going to also assess the site of where I'm going to give the medication. The skin is intact, so I'm going to go back and start prepare my secondary line. I'm going to do hand hygiene. And I'm going to take out first I'm going to remove this one because it has to be lower. And I'm going to use this one. I'm going to make sure that it's closed. This is closed. I'll take this one out. Garbage. This one. Then I am going to, everything is closed. I'm going to, before I insert, I'm going to clean the the primary port. I'm just gonna take my watch. I have cleaned the primary port. Then I am going to open the secondary port, and I am going to insert. The line would be towards the patient. My patient is a bit far away from me. Put it over here. Then I am going to, it has to be 4 drops every 15 seconds. So I am going to set my watch, and I am going to open the secondary line and let it flow towards the tip. When it's at the tip, then I'm going to open the primary line. And I'll be looking at the primary line. It should be 4 drops every 15 seconds. So I'm going to open this one. After this is done, everything is going well. I am going to ensure that my patient is okay. I'm going to ensure that the site, I'm going to stay for a while to see how the patient is reacting to the medication. I'm going to document what I did for the patient and what I observed. I'm also going to come back after I discard of everything. I am going to come back and see the patient in the next 30 minutes because the infusion is for 30 minutes. So I'm going to come back to change the lines. Thank you.